Mr. Willis, thank you for joining. Good to see you.
Thank you all for having me. How's everybody?
We're doing well. We're going into hour 4, I believe, or 3.5. So very excited for your presentation. And we're just gonna wait for others to join on. We're gonna get started shortly, okay?
Okay, no problem.
All right, wonderful. Dr. Trappel, nice to see you as well. I can't actually hear you. Or are you?
Now.
Yeah, I can hear you now.
The
Very good.
issue that I just hope every time I turn on Zoom, it'll fix itself, but we have a solution.
There you go. I think as Stephanie said, that someone can fill that out on their bingo card. Um, but it is 1:40 or 3:40. It's 1:40 for me. We will get started just to keep us on time. So I'm David Garcia. I have the privilege of serving as the moderator for this wonderful, community partnership presentations. Um, Mr. Willis, I was reading your bio, and I'm not going to take your thunder away because you have such cool nicknames. And so I will hand it over to you, Mr. Willis and Dr. Trappel, and then we will follow it up again with Ms. Duggins and Dr. Hershey. So we're going to have two speakers. We will hold questions for the end, so about 20 minutes for each speaking group. And then again, I expect full conversation with this group and potentially me having to kind of restrict time, such as Swan. So again, I will hand it over, and thank you again so much for joining us.
Thank you. I'm going to go ahead and share my screen. We just have a few slides to guide our conversation today. And maybe while I'm doing that, Waverly, you want to go ahead and introduce yourself.
Hi, everyone. My name is Waverly Willis, and I'm a barber here in Cleveland, Ohio. I also have a barber nonprofit called the Urban Barber Association, and we've been around since 2006. And through my barbershop, the Urban Barber Association is basically a network of barbershops, a few beauty salons sprinkled in there. And what we do is we use our businesses as vehicles to get information out to the community, and we do programming, which is how the urban
Do you freeze for you all too?
Yes.
really piqued my interest in getting involved with the Case Western Reserve board. So that's about it.
Okay. And you'll hear more about both of us as we talk. So I'll introduce myself briefly, and I'm sure I know most of you all from my prior involvement with the CPCRN, but I'm Erica Trappel. I'm an associate professor in population health at Case Western Reserve University, but I've had the honor of serving as the AD of Community Outreach and Engagement for the Case Comprehensive Cancer Center since 2020, and was the program leader for our PCP program prior to that. And so, as Waverly said, as part of my role, I've really the honor to work with our community advisory board. And so I'm going to apologize for those of you who were at the CCIS meeting in October, because this is sort of a reprise, a redo, but we really enjoyed that. And so we wanted to bring that again. So I'm hoping for any of you who are seeing it for the second time that there is some new little nugget that we have to share with you for you to take away from our conversation today. And so what we really wanted to talk about is where community partnership and innovation can really happen in cancer control and what it takes to do that before you ever even really get to the grant writing, the funding, and actually doing the work. And there we go. So this first one is why Waverly took Erica's phone call, or laying a foundation, how we got started. And, I mentioned that I have the opportunity to work at the Community Advisory Board. And so that's where I started. And so this project is really focused on prostate cancer. But Waverly, maybe you can say a little bit more about how you even got to our Community Advisory Board and a little bit more about what you do.
Okay. Well, again, the Urban Barber Association, we're uh, a collection of barbershops, a few salons around Cleveland. And over the years, I was noticing just in my personal chair, again, I'm a barber, lots of my clients were starting to disappear. And when I would run into a wife or a daughter or a son at the local grocery store or something, I would ask them what happened to such and such, what happened to Mike, what happened to Joe. I haven't seen him in a while. And sadly, they would tell me that, he died because he had a heart attack. He had diabetes. We could never get him to take his medication. And I took that personal because these are men that I see every week, every other week, at the least every month. And I know I would have had some type of influence over these men. And so the same struggles that they were having, unfortunately, kind of typical stuff that goes on in African American families. We're battling our weight, we're battling diabetes, heart disease, things of that nature, cancer as well. And so I just started talking to my clients about the things that I'm going through. And I mean, so we just the conversation in barbershop just kind of morphed. We always go, cry over the Cavs and the Browns. By the way, go Browns. I saw that in the chat. You know what I'm saying? But I just wanted to just have more tangible, in-depth conversation about ourselves. And we were all struggling through the same thing. So um, I learned how to take blood pressure. And I just would take the blood pressure at the barbershops when clients was waiting to get service. And all of us had high blood pressure, and we knew nothing about it. We didn't know the difference between a good blood pressure and a bad blood pressure. So I partnered up with Cleveland Clinic, and we brought some professionals in to screen us, educate us, and refer us to physicians. And as I'm taking my numbers, I'm learning about the grant world. You got to have the numbers. I just want to do the work, but in order to get the money, you got to have the numbers. So I'm taking numbers, and I'm noticing all of our blood pressures is going down. So, my proudest moments is when on a Saturday and the barbershop is filled up with all these old, big, burly, macho men, and we're talking about vegetarian lasagna recipes or yoga poses or something like that. Those are my proudest moments. We just changed the conversation. And at the same time, I got wind of the Case Western Reserve Comprehensive Cancer Board, and I'm seeing the work that they're doing in the community. And so I'm just one little barber, and I might give one or two of my friends that own shops, and we're making a difference in our immediate community. So I'm thinking, if I could link up with a juggernaut that's nationally known as well as the Case Western Reserve University, is that would really help me expand my reach. And so at the same time, the Case Western University board, they needed a liaison into our community, because a lot of our barbershops are in the disenfranchised neighborhood, the hood, if you will. And so not anyone can just walk up into the shop and say, hey, we want to run some screens and do some tests on you guys. So over the years, so of course I took Erica's call because I was watching them. Apparently they had been watching me. And so we just started having those conversations. They were telling me about the things they heard that I was doing. And I was telling them, hey, I see you guys are doing X, Y, and Z. And it was just some synergy there. And it took us a while before we actually worked together. They invited me to be on the board. So I just kind of sat quietly in the back. A lot of times when I'm in meetings like this, and I've been intimidated in the past because everybody got a bunch of letters behind their name, and I'm just Waverly the barber. You know what I'm saying? But I know my role and my importance. My role is the liaison to get help for my community. And so, with that being said, if I have to vouch for entities like Case, I have to vet them because my people trust me. And so that's why I took the phone call, and that's how the foundation gets started. Erica, perhaps you can piggyback on that.
I will. So I think anybody who's in COE is always just wishes that that change agent in our community seeks us out, right? And so I was really lucky to have, to sort of inherit this relationship. But I think what Waverly's talking about is what many of us talk about, is that when we do this community work, we need to start with building relationships before we can move to transactions, right? And so to really understand what are the values, what are we coming for, where do we share values in the work, and do we understand what we're doing? So because we had started to start that relationship, that's certainly why he took my call. But then, why did we keep talking? And here, right, so it's not just that first call, but how do you keep that discussion going? And so here it's really, again, we're building on that relationship and understanding what each of us has to bring and the value of what each of us brings, and adding our own perspective to make the work better, right? If we keep it within the institutions, we're missing out so much on how things happen. Right, part of this is also, how do we build our partnership so that partners are ready to act when the opportunity arises? And so part of this is the work that we kept doing. I'm learning more about what Waverly's doing. He's learning more about what we're doing. And part of that responsibility also means understanding the value of the research to our community partners and aligning that research and our research goals with community goals, and working with those partners to figure out what their goals are. Waverly, do you want to add any more on that?
I just want to say something about that. Uh, just to, just to piggyback on what Erica was saying, they're watching me. Erica and I we're talking. I'm on the board now. I'm watching, and I'm amazed at the reach that Case has and the resources that Case has. Um, so at the same time, I'm learning that my community is dying because we have trust issues, obviously because of the history. And so I'm having conversations with Case, but I'm also having conversations with the barbershops as well, saying, hey man, you know, it's hard to convince a 70-year-old Black man to do a study. You know what I'm saying? Because he's older and he's set in his ways. And so I had to really do some vetting and really I really trust Case, and I really went to bat. And the conversations that Erica and the rest of the board were not privy to that went on was kind of intense conversations. But again, I'm seeing the numbers. I'm seeing that my people are dying because they won't get involved. They won't let people in to get tested, to get these screens done. Again, obviously because of historical reasons, Tuskegee Airmen and other circumstances that happened in the past. And so I'm having these tough conversations, and finally, little by little, we just started doing. I was really thrilled that they did what we did, a tour, just a strictly a listening tour, and I thought that was the greatest idea in the world, Erica. That they brought food to our businesses, and we got to invite anybody we wanted from our communities, and they brought administration as well as physicians in, and they just heard us out. So we did it at barbershops, we did it at rec centers, and we did it at church. Again, that's forging that relationship and building that trust. And I think that was really paramount, and what's making the current prostate program such a overwhelming success is we trust Case now. And it took some time, but the trust is there.
So I'll use this as an opportunity to put a little asterisk. I'm able to sort of have this. I recognize the uniqueness of being the AD and having the direct partnership with the community advisory board. That has facilitated our ability to get this off. But I think it's also, right, I also keep that as a responsibility to think about how within my own cancer center I'm facilitating those relationships for others, particularly junior colleagues who don't have the time to sort of go through this process, but who can be brought in to where we already have trusting relationships, and sort of accelerate the timeline on the trust building that we know has to happen before we move to transaction. And I think it's also why it's valuable to have this sort of a network of people, right, where we also recognize the importance of building from the assets of our relationships, so that we're not leaving people out sort of good luck going to find someone and meet someone, but how can we bring you into this fold of trust? What's valuable too is then we have an established set of norms and expectations and values about how we do community work, in the Case Comprehensive Cancer Center and in this context. And so we can bring our academic colleagues along as well and helping them understand what are the expectations when you do this work. How do you establish your relationships, and how do you really follow through on your commitments, and how do you understand your values and build those relationships yourselves? So this has all laid a really great foundation for us to move on to our big idea, right? And moving into our research project. So we had an opportunity to really think about how we wanted to address prostate cancer screening disparities in Cleveland. And probably just like in all of your communities, both incidence and mortality are more than, nearly double in African Americans compared to whites. And so this has been a really crucial issue because, like Waverly said, he's seeing his clients die, right? People in his community are dying. So it gave us an opportunity, because we already had this trust established, to say, what's our big idea? So instead of saying, Waverly, I want to do all these things, I said, what do you think? Let's have a conversation. What's the big idea? And one of the things here, we talk about developing it as an implementation research project, is that we had to really make sure that we weren't letting jargon get in the way of a good idea, right? And so we broke it down into what's really the problem? What do we think is the problem? And what are the innovative solutions? And we can back that into our scientific language, right? We can back that into a study design. We can back that into our implementation science questions. But what we started to realize is when we're using sort of the jargon, it puts some distance, right, between the opportunity for really good big ideas to come out, right? And so instead of using some jargon, instead of framing it that way, and instead saying, what can we do together, right? I'll never forget the day I was standing in my dining room, because it was still during COVID times. And Waverly says, Erica, you got to get in my shop. This is what we need to do. This is how we're going to try something different. We need to bring it to the community. Why do we need to, if it's just a blood draw, why do we need to go all this distance? Can't you just bring a phlebotomist? It's like, oh, maybe we can do that, right? So when we have, the building on a relationship, moving forward, framing the idea, framing the problem, and then not letting jargon get in our way, right? And sort of understanding, let's find our shared language, and we can back it up and we can, explain it. But when we provide an explanation of what we're doing, what we'll learn, and what impact we have, that's what everybody really wants to know, right? That should be that universal explanation of why we want to do a project and what we need to do. Waverly, I think you had some really great things to say about jargon as well. Oh, you frozen?
A lot of times when I'm in these meetings, and even after our meeting, sometime I'll send Erica a text or even call her or some of the other members that's on the board or the staff of the board, and I'll say, I don't know what that doctor just said. You know what I'm saying? I oftentimes have to tell them, look, you have to tell me these things in layman's terms, because I, in turn, have to go back to my people and then explain it. And I don't know 90% of the words that you're saying. I guess sometimes when researchers are used to only having conversation with researchers, you guys can understand that stuff, but we can't. And so we have to break it down, as easy, maybe in bite-sized chunk and the easiest word possible. And because I want to sound like I know what I'm talking about, because essentially I know these people, but the people I'm trying to bring them to, they don't know them. So I have to sound like I know what I'm talking about. And part of the developing and implementation research project, I was so thrilled again, because a lot of times when I'm saying, well, yeah, it might be a blood. What? Who are these people you want to come bring to the shop and take our blood? You know what I'm saying? But they were actually willing to come. They wasn't. I was the liaison as far as the introduction, but they came out of their offices, out of their labs, to the barbershop, to the church, to the rec center. They came from their places of employment in the community, and they faced us, because they could have easily said, well, Waverly, tell them this, tell them that. And then I could have went to them, and then they could have told me, Waverly, you tell Case this and Case that. So no, we brought everybody together. And prior to bringing them together, I said, hey guys, the Case, look, we got to talk like we regular people. Everybody don't have PhDs and master's degrees and stuff. You know what I'm saying? Some of us are plumbers and barbers and stuff. So you got to talk to us on that level. And I think that over the years, I still have to make side calls and side text messages every now and then to get some understanding. But they've done a great job at kind of, for lack of a better term, I'm just saying dumbing it down so I can understand it. And when I understand it firmly, I can sound like an educated person when I'm taking it to the people.
So I will say, in the same way that Waverly says I dumb down the science, I would say he dumbs down what happens in a real barbershop, right? And I think both of us understanding that, right, is what helps us get to what we both need, because we come to this work recognizing that we both might have the shared value of having impact in our community, but we have, other things, we have things that we need to accomplish. Waverly's a businessman, right? I'm in an academic setting and have academic expectations. So part of the success of what we've done here, built on a foundation, identified an opportunity, but then we had to understand what each of us needed in this relationship to make it something of value for both of us. And so again, just like I explained the science, I had to, going into this, clearly I have long curly hair. I don't go to a barbershop, right? I rarely get my hair cut. And certainly not in a barbershop. That would be an experience. So I really had to learn a lot about that context as well to understand, how, what typically happens, so that we might, again, think about, well, how are we going to do data collection? How are we going to do program development and delivery? What is this context and why does it work? How do we make sure we don't mess up the magic of a barbershop to talk about prostate cancer screening, right? So, and again, you can have these honest conversations about, what do I need? What do you need? How do we meet our needs? And how do we stay sensitive to that and make sure those are met while also doing really, really good work?
So I'm going to jump in to kind of keep us on time. I could hear you guys talk all day. This is so much fun. Mr. Wells, thank you so much, Dr. Trappel. We still gonna have some time, so the group, everybody's gonna have access to them, I promise. But I love, again, like the shared language, the impact. Transparently, I'm a Steelers fan, guys. So that kind of hurt, but you guys just kind of brought me into the Browns. So we will all be collaborative in this space. But next up, we're gonna go to the Angelic Warrior Foundation again, Ms. Duggins, in addition to our own Dr. Hershey. So I'll hand it over and let's hear some more. Thank you.
All right, I just need one moment here to pull up our slides. There we go. All right, hello everyone again. And yes, I agree completely. I want to hear more. So thank you for what you have shared, Waverly and Erica, really inspirational work. And now for the best part of my day, I've been looking forward to when I get to connect with Paulette. We're going to share about what we feel is a very meaningful community research partnership that we have between the Angelic Warrior Foundation and Striving to Hold Accountability and Research Equity, which is a community advisory board that guides my research program that I'll be telling you about. I know, many of you know me from the CPCRN. I am an assistant professor in the School of Nursing at UNC and a member of the Comprehensive Cancer Center at Lineberger. And my research is focused on health equity, survivorship. And as I've worked with cancer survivors, I've really learned that survivorship includes prevention and screening. So I now think of myself as a prevention and screening researcher as well. And I'll turn it to Paulette to introduce herself.
All right. Thank you, Rachel, and good afternoon, everybody. My name is Paulette Duggins, and I am co-founder and president of the Angelic Warrior Foundation. My background prior to the nonprofit world was in education. I have over 15 years in the public school system. And my greatest passion now is spreading awareness about colorectal cancer and providing support to patients and caregivers. All right, next slide.
So we're going to share a little about how we met. When I started my first tenure track position, I thought, the kind of work that I wanted to do, the first thing I needed to do was develop a community advisory board. So that was what I did before I wrote a grant or before I did anything. I was, really increasingly just being inspired by the impact of communities through that work. And I was having a day, sitting at my desk, just feeling super discouraged by research that can happen sometimes. I'm a nurse by training, so I used to see and feel the impact I had on people's lives every day. I could see it in their eyes when I was working with a patient. And some days, the 12-hour days writing at my desk, I don't feel that. I feel discouraged. So I was just looking around online and I found the Angelic Warrior Foundation. I came across it and I looked through their whole site and I thought, wow, these are people who are doing the thing that I want to do, but they're, this is impact here. And I thought, I wish I could go work for them. And I didn't really know what to do. So there was, you can make a donation. I thought, gosh, that's the least I could do. So I did. I made a donation, and that unexpectedly led to our next steps, which Paulette will share about.
Yes, absolutely. That one donation and her feeling discouraged led to something very, very important. Prior to Rachel making the donation, the Angelic Warrior Foundation was only like a year and a half old. And so most of our startup funds came from merchandise that we were selling on our website, and then donations from local people that knew about us and knew about how we got started. So when I received the email notification for a new donation, I opened up the email and observed the donation amount and the name. And I was like, and I'd recognized all the donors before. And so this name was just kind of popped out to me. And I was like, well, let me research and see who is this and try to find out how they found us and, just what their interest is. And so we did, and I took it to my board as well. And we kind of Googled and we found Rachel. And then we saw that she was connected with UNC Lineberger. And we saw a lot of the work she was doing. And I was like, let's reach out to her and find out how she found us and what inspired her to make a donation. We weren't just satisfied with the donation. We wanted to know more about her and how she found us and how she became interested in it. So to make a long story short, that's how we found her and that's how we connected. And then we set up a meeting and we met. And as soon as we met, we had like-minded passions and goals, and we just hit it off. And we both had so many ideas, and it just kind of started from there. All right, next slide, Rachel.
So I mentioned the community advisory board that guides my research program. When Paulette and I were having our first conversation, as she said, it was like, we had known each other, it was very organic and easy to talk, so much excitement. And it was clear, let's work together. But where to begin, I was really sensitive and concerned about burdening her and the organization and hesitant to ask and a little nervous if I should even bring up the community advisory board. But, I invited her to a meeting. At the time we were meeting on via Zoom every other month. I told her about it, kind of open invite. She came, and Paulette, you could share about, the next thing that I knew, she, was on the board and pretty quickly and organically, if you want to share about your decision there.
Absolutely. So again, like she said, she invited me to a share meeting. I attended the meeting and met the rest of the CAB members. And I was very impressed with the vast experience and the relationships with cancer that, each individual person brought to the table. And then I also enjoyed the fellowship. Like, I sat in on the meeting and I kind of listened to what they were talking about and the ideas they had and what the work that they were doing. And I was just really impressed. And I was impressed with the how they were just all mutually passionate about what they were doing. And then they not only welcomed me, but they welcomed my ideas. They were supportive and interested in the work that I was doing. So, I gladly attended a second meeting. And then when I attended the second meeting, it was during that meeting that they said, we would like to invite you to join if you're interested, no pressure. But if you're interested in joining, since, you're hanging out with us anyway, and you seem to, really just fit right in, you're welcome to join. And that was a no-brainer. I was like, yes, of course I will. And so then we got started from there on the shared CAB team. All right, next slide.
So it was about 2020 when Paulette joined us on the share team. And we had been working on, I had presented work at different conferences and things, and I was getting emails all the time about how did you develop this community advisory board? So the team and I actually wrote a paper about how we came together, consensus building workshop that our Office of Community Outreach and Engagement at the Cancer Center helped with. We, developed a shared mission. We named the CAB together, shared values that guide us. So we wrote a paper that kind of details like kind of the nuts and bolts, nitty gritty of like, we hear about these things, build partnerships, build trust. How? What does that look like? Have a shared vision. How do you come to that with people you met in the last year, So we shared that. And then at the time, I had a small foundation grant where I was looking at, it was a qualitative study looking at barriers and facilitators of physical activity in Black and African American cancer survivors. The CAB members had helped with, the earlier aspects of that work. And when Paulette came on, we were just wrapping up data collection. So she was really integral to the analysis and evaluation and planning next steps, which now we're preparing to test a physical activity intervention for Black patients recently diagnosed with colorectal cancer. And Paulette and the Angelic Warrior Foundation have been really involved in developing the intervention and planning recruitment. And Paulette, if you want to speak to a little bit of that experience from your perspective.
Okay, sure will. As it relates to the intervention materials and recruitment plans, the CAB group as a whole came up with some very creative ideas. But then from an AWF standpoint, we were very sensitive to the needs of patients, like from our own personal experiences with cancer. So we thought that care packages with comfort items to give those patients participating in the study would be a great idea. So we came up with getting ginger chews to include in like a basket or a care package. Ginger chews help with nausea. Comfy socks, nice comfortable socks, so that when they're in treatment, they can have something comfortable on their feet, or even when they're at home. Healing lotions to help with the dry effects of chemo on the skin. And then personally designed motivational cards to help inspire and encourage the patients. So those were some of the things that AWF brought to the table, in addition to like the Fitbit activity and the daily step goals and the motivational text that we all as a group came up with. Next slide.
And on the Community Advisory Board share, we all, really work to uplift the goals and missions and values of all of the members' work. For example, tomorrow night, Paulette and I will be traveling to Raleigh to meet with the North Carolina Minority Prostate Action Awareness team to join one of our other board members, Mr. Milner, as he also sits on that board and is very active in that work. And we've also done health fair work with one of our other members, which Paulette will share about.
Okay, so yes, one of our members, Deidre Lee, has started a breast cancer support group within her church. And each year they sponsor a health fair, which had been halted due to COVID. And so this year, it was able to start back up, and we were more than happy to join her in those efforts. And we had over 59 attendees, a variety of vendors sharing information from information about COVID-19, physical activity, diet, insurance, mental health, substance abuse, pediatric dental care, you name it, we had all kind of resources. There were 20 flu vaccines administered, 20 plus blood pressure screenings done, and 20 plus blood donations. So it was a very successful event. Next slide.
And then, again, we talk about, measuring the impact of our work and what we do as researchers. And for me, you can't find the impact of my work on my CV or NIH Reporter or on PubMed. I mean, I know I need those metrics to keep my job, but they mean nothing to me. I've had certain times in my life, I could describe several of them where I said, that's how I know I'm doing what I want to do. It's like a hit you in the heart moment, right? And one of those biggest moments for me came over the summer when Paula asked me to join the Angelic Warrior Foundation as a board member. And I want to leave it to Paulette to tell you about the Angelic Warrior Foundation.
Okay. So the Angelic Warrior Foundation was founded in 2020 after the passing of my daughter, Angelica Duggins, best known to us as Angel. Angel was diagnosed with stage 4 colon cancer at the age of 29, and she passed away at the age of 32. Angel's diagnosis came as a very unpleasant surprise to us, as she had no symptoms at first glance that would have alerted us or her physicians to colon cancer. During Angel's treatments, she often spoke about starting a nonprofit to help other patients. During chemo treatments, she was always looking around at other people, observing what they were doing, observing whether they had family members there with them versus her having a whole room full where some people had to be kicked out. And she was very concerned about that. So she often had conversations with us, with her family about when she got done with her treatment, she wanted to start a nonprofit to help other cancer patients. And so actually this foundation was founded by Angel. We just, once she passed, we had to put it into action. So that is how we got started. Next slide.
And with that, we talk about how the community knows what the community needs, right? And with the Angelic Warrior Foundation, it's just such a powerful and beautiful example of that. Paulette had been to Winston-Salem State University. She said, we need to get the word out about early onset awareness or early onset colorectal cancer. We need to get this word out. And she was doing that. And we know that it's on the rise in younger people. We know that prevalence, Black communities more impacted. But as we have been reaching out to universities more, everybody's known this for a long time as we're catching up with like our efforts in research to focus on these populations. It wouldn't, if I was going to do, a screening program, 18-year-olds wouldn't have been the first population that I would have thought of maybe. But once I saw what Paulette was doing and really started listening, I said, this is incredible. And this is incredible. How can we do this larger? And I saw the community pilot grant through our cancer center and shared that with the foundation, encouraged Paulette to apply. And it was successful. So if you want to share a little about that project experience.
Yes. Okay. So our project, the Colorectal Cancer Awareness Project, is specifically focusing on spreading awareness about early onset CRC, to make the community and especially younger people more aware of the prevalence of CRC diagnoses with people under the screening age, which we know the screening age has now been lowered to 45, but that's still just not enough because you have people 18 and up being diagnosed. So the whole objective of the project is to partner with at least 4 universities and 2 churches, and with at least 2 of those universities being historically Black colleges, so that we can reach those minorities. And from each university, we want at least 2 student ambassadors involved in this process and 1 church champion. And then the whole idea is to plan an EBI in order to educate and spread awareness. As Rachel said, AWF had already been kind of doing this. We had been going to health fairs and sharing this information. But it was when I attended a cancer awareness event on the campus of Winston-Salem State University that I knew we had to do more because I had students come to my table when I was sharing information. They had no clue. They were not aware that it was, on the rise among young people. They didn't know much about it at all. And, some for, a little bit were not too concerned because they're like, that's an older people disease. And so immediately I was like, oh no, we have to do more than this. We have got to get this word out. And it was like, so then my passion became, I have got to get on these college campuses. We have got to get on these college campuses and spread this awareness and make these young people more aware and help them to learn what to do to prevent this disease and know what could make them, more at risk. And so being that all that was already on my radar, when Rachel mentioned the pilot grant, I was like, God, this is perfect. And so she led me to that. I applied. And then, it got accepted, which I was just so excited about that. And it has just been a blessing to have Rachel on the team. As she said, she got invited on the board. And I can't remember which happened first, but it was just like we were doing so much together. And she was so valuable, had so much knowledge and information that was helping us, that we definitely had to have her on the board. And so then having her as a researcher was just so valuable because, again, like as Waverly was mentioned, we're grassroots. We're out here in the community. We're doing the work, but we don't have the PhDs and we don't have research background. So having a researcher on our team has just been a godsend. And Rachel has just really been advising us and helping us helping us to put the work into perspective with the research. And so that has truly been a blessing. Thank you, Rachel. Next slide.
And we have all sorts of things going on with the Angelic Warrior Foundation. As a board member, I'll give you all a personal invitation to practice your own cancer prevention. Join us for a 5K this April. It's in person in Winston-Salem, but it's also virtual. And we have, this was started in COVID times, so it's been conducted through COVID times. So we have a great virtual event too. So, want to get the word out about the amazing work of AWF. And then we'll kind of just conclude with, how are we nurturing this partnership and keeping it going? And as we talk to different groups, the kind of number one question, or one of the first questions, we know we're going to get a question about it, is, how do you do this? Like, how do you fund it? What do you do in between funding? We hear that one a lot, which is always funny to me because I started with no funding. So, when we got started, I didn't have a grant when I got started with all my members. So the key for me was being really transparent about that. I by no means want to give the impression that it is not important to pay our community partners. I do pay all of my community partners. That was top priority for me to figure out how to do that from day one. But I was transparent in, we're going to decide the amounts together. We're going to, I don't know exactly what this is going to look like right now. I'm working on it. Here's the update. I had startup funds at the time, but because of freezes on state funds, I actually wasn't allowed to use them. So it was really hard for a while. And we have figured that out. But I think what was more important than that was just kind of showing up, and like showing up with no agenda, right? Like, when I first met with Paulette, I had I had no plans or no idea of what we would do together. It was like, let's just keep talking, find where we have the same interests and follow where it goes together. If I lost my job today, my work with AWF would continue. So I think if you start there, then it happens organically. I would also say that, communication is so important. We communicate, we have Zoom meetings, we're on email, we have a shared Fitbit group, we text message, we're on Facebook together. We have in-person research retreats 1 to 2 times a year. We're just always in touch with each other. I think this is like the 3rd or 4th time I've seen Paulette this week. And, I'll also say just the most important thing is, being tied to your partner's mission. I think almost, everybody I talk with now who's doing research, we want to follow the best methods. We want to do high quality work. We know that involves community engagement. But that is simply not enough when it comes to this kind of work. That has to be first and foremost. It has to be something that you would be doing when the study ends, or when you change, if you made a career change. That's what's been most important for me. Paulette, what would you say?
Okay. I would say what's been most important for me is definitely having like-minded passions and purposes. Because it's like immediately when we met up, it was like, I mean, we had no idea when she sent that donation, and I'm sure she had no idea when we reached out to her after she gave that donation. We had no idea what was in store for us. But then just meeting, we realized how passionate we both were about educating and about trying to help prevent disease and about health disparities. So what's most important to me is just like that passion, linking up with someone and connecting with someone who has like passions and has that same purpose. And we're all working towards the same goal. That has just been beautiful to me. And I think that's what makes our partnership so great and so effective. And also reciprocation of support. We support one another. It's not a one-way street. It's a two-way street. We're looking, okay, Rachel, what can we do for you? Rachel, what's going on with you? And she's like, Paula, what's going on? What do we need? What's next on your agenda? What is AWF doing next? How can we support you? That's what makes this partnership so great. And that's what is really important to me.
Wow. So I'll step in, briefly summarize, and I'll open up to the group because I imagine we could talk again literally all day about this. First, Ms. Duggan, thank you for sharing your story with us and like your vulnerability with the group, but also to honor your daughter. Like, there's no words to describe that. And also, Rachel, for acknowledging that, but also, like you kind of said, like if I were to lose my job, the work would continue on without me, right? And I think when I was writing down some keywords, it kept coming up like shared values, right? Our purpose. And sometimes those metrics don't directly align with always our academic outputs, and in fact, and I wrote this down, with our heart. And that's why there's a lot of hearts, I think, to the right side of the chat. So again, I want to acknowledge not only the community partners that are present in addition to this conversation, but there's also many others, right? Even I know we have some from the University of Arizona. So again, thank you to all those community partners. Waverly, I know you'd mentioned like, oh, I'm just a bar. No, you are the expert, my friend. You're much more than that. In fact, all our community partners are the experts, and it's up to us to have that bi-directional relationship, which we can build a capacity. So with that, I'll be quiet now. I will open it up for questions or any comments. I mean, I imagine there's a lot to talk about. We have about 13 minutes or so left in this wonderful session.
I'll just say this was brilliant and inspirational. It was really, really good. I've been doing this work for 45 years, and this is the best I've ever heard in terms of community engagement. Fabulous.
If I could just share a quick story while we got a moment of pause. I was in the store recently, and I have 3 barbershops here in Cleveland. And a lady comes up to me and she has tears in her eyes. And I vaguely know her face, but not really. And she's approaching me and her arms are held out. And she's like, I just want to hug you. Can I please just give you a hug? So it was kind of weird. I'm like, okay. And she hugged me so tight. And then she told me, she's like, my husband is a client at one of your barbershops and he never goes to the doctor. And you guys got him to participate in your prostate screening. And he got diagnosed with prostate cancer. And she said the doctor said that it's early stages, which I've learned through my research with Case. It's a 90 percentile of surviving. And she was just so grateful because she could never get her husband to go to the doctor, but the fellas at the barbershop got him to get on that bus and give his blood sample. And so He's going to be all right.
That is an amazing story. And again, like, oh my gosh, thank you for sharing that, Waverly. I saw Dr. Palmer, and if anybody else, you can jump, like raise your hand. Anybody wants to kind of jump in. Otherwise, I could ask questions all day. Dr. Palmer, did you come off? Did you have a question or comment?
I almost can't talk, y'all. My heart is so full because, David knows me and some of you know me and know that this is the kind of work that I've always been involved with, that I continue to be involved with, that I wanted to see get elevated. And so I'm just so grateful to see this kind of work being done, for people to really acknowledge the expertise that lives in the community, that assets that are in the community, that we're not just looking at these communities from a deficit lens, that there are assets to be leveraged and knowledge and passion. And so I'm just really thankful to see the community partners here. I'm thankful to hear Rachel talk about the fact that she would do this whether or not she was being paid or part of her job, and understanding the value of giving and not just being on the receiving end as an academic is so important. And so again, shout out Northeast Ohio. I'm from Akron, so go Browns, go Cavs. And that's all I'll say, because I'm just in a really good place with hearing all of this. Thank you all.
And if I may say, I just want to say to Waverly and Erica, I commend you both on the work that you're doing as well. Waverly, I love what you're doing. I love how you got started, looking at, like you said, in the barbershop and taking that and running with it, and partnering with Case. I think it's just beautiful. And then, like, even here, I was about like Kelly, I was about in tears. I was having chills when you were talking about, your clients being missing, and then you running into family. I mean, that was just like, that shows your drive and your care and your concern for your community. And that says a lot. So I think what you guys are doing is beautiful, and you to be commended for that.
Thank you. I appreciate that.
This is the only downside to a virtual meeting, because I want to be like, oh, let's go have another little conversation.
Right.
Keep this going, right?
Yeah,
Because I feel the same way about your story as well. It's just wonderful, wonderful.
Thank you.
And actually, I was going to ask about, like, your stories are really interesting because, again, it was like, and I wrote that, like, some Googling involved, right? Some vetting, some of that investment. And really, it was kind of like it's like the left hand didn't know what the right hand needed until you guys kind of like made the connections. And often, I think that oftentimes happens a lot. So I'm actually interested in asking the community partners. So, like, what can, like, academics or institutions or anybody else for that matter, like, how can we help facilitate more support for the community, in your opinion? Understanding like the different steps that you went through. But if you were to like wave the magic wand, quote unquote, like, what would you like to see from like CPCRN or others to help facilitate more, not only community engagement, but I say community empowerment, and helping facilitate more of the work that you all carry out?
Good question. Are you asking us?
Yeah. Yep.
No. Okay. I don't know. I would say, like, do just like how Rachel did. Search us out. Rachel had no idea exactly the extent of what we were doing or what we needed until she sought us out. So I would say, like, as you're developing your different programs, if your focus is prostate cancer, then do that research. Google and see who's doing what in what community. See what impact they're having, or see what needs they have. Because that was so genuine the way we did that. And like, even like I said, with her doing a donation, but she had no clue. But here we were so, again, we weren't so much concerned about the donation as we were as to what made her reach out to us and how did she find us. And then since then, I've had another experience with someone else reaching out to us and want to partner with us. And same way. Now this one, she heard about us through someone else, also through UNC. But then she looked us up and she saw the work, and then she was like, "Oh yes, I want to work with them." So I would say that, as far as the academics, if those programs would do the same thing, because a lot of times we're on the ground working, and we don't know about you all either. And so, and then, and I guess you guys might have more resources to seek us out than we would you, unless we get connected with somebody like Rachel who already is connected with you and know about you.
Thank you for sharing that. Waverly, do you have anything to add to that, sir?
Yeah, definitely. It's a lot of people that are boots on the ground, just serious community activists. Just to echo what she just said, they don't know the administrative side. They know the work because they're driven by their heart. They're driven by the passion. And the same thing as me, seeing people die needlessly in their communities for whatever reason. So yeah, please reach out, do your research, because it's a lot of people like me that aren't as fortunate enough to have a Erica Trappel and a Case Western Reserve juggernaut.
He's freezing up a little bit.
He is actually at the Barber College right now,
Oh,
and it has
Behind
that.
them.
Yeah.
I'm sorry, my connection is terrible here.
okay.
But yeah, just to echo what she said, just reach out, find us, because we're here. We're just working.
Absolutely.
As soon as you just say Barber College right there, you could just add education, Waverly. Whole new project.
We've talked about it.
So thank you for sharing. Again, I think it came up in the conversation too, like the listening tour aspect.
Mm-hmm.
A lot of times we come in as academics, like we talk at communities in some cases. Sometimes it's okay just to listen. And so I like that aspect of a listening tour because it's a way to kind of understand and absorb it all and then react. Again, it's not just the metrics or outcomes, but again, like what does the community want and need?
Mm-hmm.
And actually, so I will ask that question then if there's no one else who wants to jump into like the academics, actually. So Rachel and Erica, would you like to like weigh in on the other side of that? Like what you think we could do more if you could wave your magic wand?
Yeah, sure. I think part of the work is like spending time and figuring out, like, yes, I will ask, what do you need? How can I help? But I think at the same time, community partners can be like, well, how can you help me? What can you do? So there's this kind of bi-directional, like, just spending time together and figuring it out. And I think what we can do more of is, we're in positions. I mean, so my work relates directly to racism as I focus on the Black community, right? And as a white woman, I'm serving a community that I'm not a part of. So I've delved deep into what that means. And for me, it's always looking at like power and where do you hold power? What can you do with that? So as academics, we can figure out grant funding. We can navigate these systems. So in my research life, it's like, oh my gosh, how do we increase colorectal cancer screening in the Black community? And like, this is such a hard thing to do. And like, it's so hard to recruit participants to studies. And then I'm with my community partners and they can get people to line up. We just can't get the fit kits to their church because of all the systemic barriers that can be involved there. So I think if we just show up and figure out, like, just observe and learn, and they're doing the thing, we can then figure out like, oh, well, let me figure this out. I can get these resources and we can make this happen.
Yeah. That's so much the experience. I'll share something a little bit different. And one of the things that we're thinking about is that there's a lot more attention on community partnership and community engagement. And what we see is that people who haven't done it before are trying to figure out what to do, or they're saying it's too hard, right? And the questions are, well, we just need to get them into our trials, or, right, this sort of discussion, or we don't know how to connect. And so we're sort of reframing with sort of coming with a bit of a sort of a gentle heart to folks who we're calling community curious, right? Who've never really done it, but think they want to try it out, but aren't really sure. But also, right, who who think that it's a really big, heavy lift. And so, how do we sort of make it easier for folks to sort of explore their curiosity around engagement, make sure it doesn't damage the relationships, right, and partnerships that we already have, but sort of share what the flavor looks like and the benefits, really demonstrate the benefits to their research and how they might ask questions differently or be impactful differently. Right. When I frame it as, look, we're all here because we have a commitment to reduce the burden of cancer. That's something we can all get behind, right? We're just maybe coming at it or thinking about it a little bit differently. So how do we make it easier for people to do this work without damaging or jeopardizing some of the things that we've done?
Thank you, Erica and Prajakta. And it looks like you just coined a new phrase as well. Please jump in. I know we're about to transition to the close, but let's hear this last one really quick. Prajakta.
Yeah, sorry. Thank you so much, Erica Waverly. I've seen you earlier, so just amazing stuff. And Rachel, you and AWF, you guys are such an inspiration. It's amazing. One of the questions that I've been toying in personally, having stayed in this space for a long time, is what's the role of research institutions in some of these supportive partnerships? Could each of your partnerships sort of comment on research institutions' role in supporting and building capacity for these partnerships?
Sure. I'll kick that off, and I think it's because I have the easy one, right? We're working with, NCI Comprehensive Cancer Centers are required to have community outreach and engagement, and a community advisory board is a big part of that. So that is built into our grant infrastructure. Now, if we didn't have it, would we have it? It probably wouldn't look the same, right? I don't know how many of you are a part of your Clinical and Translational Science Awards. That also has a very significant community and stakeholder engagement. We're coordinating on some of this community curious effort, right? So that we're doing it at more of an institutional level instead of the one-off level. Because those of us who've done this at the one-off level for the last 20 years, it's a lot. And so we are really trying to now advocate up into our infrastructure and our institutions to say, I think you do have this. I think there are also other efforts that are encouraging our institutions to go towards this, like the Carnegie designation, right? That makes them also think about being good community partners in different ways besides research. And so I think there's just this really nice alignment that requires our institutions to not just say they're doing it, but be more authentic in how they approach it.
I think the only thing I can add, Prajakta, I feel like I'm like boots on the ground in the weeds. Like I have that same question. So I was excited to hear, what Erica was going to suggest. In terms of like being in an academic research, it's, you hear it all the time, just the time, there isn't the value placed on these relationships that needs to be and what goes into them in academics broadly. And yes, I can get funding and, hire somebody to help with the community advisory board. I can't, I need to do that. I need to be putting in, it needs to be my face, me, my body. And that's what makes it work, that we have this connection. So that is, so the expectations of, what requires us to be in these research positions is what I think needs to change to do this kind of work.
Yeah. I was going to type it, but I'll say very quickly, outside of operational logistic, because exactly what you said, right, Rachel, it still has to be us. We have actually integrated into our School of Medicine metrics recognition of community outreach and engagement expectations every year. So we're reporting on those metrics, and they are now considerations in our promotion and tenure packets. So the work that I did was actually valued and recognized, right? As opposed to where's your international presence? The deep engagement work was valued just as much. So I think those are the other pieces that have to shift in order for there to be institutional support across the board.
Thank you for that, Erica. And I think that's key, right? When you talk about systemic or structural barriers, like having that value by your institution, I think is pretty significant, particularly for the junior faculty or those postdocs and those moving forward. So hopefully we continue to have this shift to continue to value our community partnerships, and again, bring. I always have this thing. It's not just bring people to the table, but help us set the table, make the table, build a better table together that we can all sit at. So again, Paulette and Waverly, thank you so much for your participation today. I think this is a nice way to kind of close us out. And Erica and Rachel, again, for your efforts and for really being leaders in this field. So thank you again. It looks like James has other questions. I'll let those get answered to the side. I'll actually hand it to Swan. We have all our co-chairs to have some closing remarks. I'll let Swan start it off. Or actually, I can hand it over to Stephanie, actually, because I see the moderation. We can just get going towards the end. Thank you all again.